Hello, everyone. I'm Mitra Asadi, Fellow in Endocrinology Department in UIHC. Thank you very much for completing the survey. I'm going to briefly talk about metabolic dysfunction associated with steatotic liver disease, or MASLD. So MASLD is a new terminology replacing non-alcoholic fatty liver disease. It happened in 2023 after several hepatology organizations decided to call the disease what it is, not what it's not, and to remove the stigma of non-alcoholic and fatty from the disease name. Spectrum of disease includes steatosis, affecting 5% or more of hepatocytes, which can result in steatohepatitis or MASH, again, which may or may not have associated fibrosis or eventually cirrhosis or hepatocellular carcinoma. We have to exclude other etiologies of chronic liver disease like high alcohol intake, hepatitis, viral hepatitis, HIV, or medications like steroids before making the diagnosis. So steatotic liver disease is an umbrella term. It contains metabolic dysfunction associated with steatotic liver disease, or a combination of metabolic disorder and alcohol use disorder, steatotic liver disease, when patients have metabolic dysfunction, but at the same time are drinking more than recommended alcohol, like more than 140 grams per week for women or more than 210 grams per week for men. Steatotic liver disease can be just because of alcohol use if there's no metabolic dysfunction present, or because of drugs or cryptogenic or genetic diseases. So when we say metabolic dysfunction associated, we mean that patients should meet at least one out of criteria for metabolic dysfunction, like elevated BMI or waist circumference, or elevated blood glucose, or diagnosis of diabetes, type 2 diabetes, or if they are getting any treatment for type 2 diabetes, elevated blood pressure, or if they are getting any antihypertensive medication, elevated plasma triglyceride, or low plasma HDL, or if they are receiving any lipid-lowering treatment. Why it is important? Because of the epidemiology. The global prevalence is 30% and US prevalence is 33%, and it's rising. It's rapidly becoming the top indication for liver transplant among those who are listed for hepatocellular carcinoma, and becoming the most prevalent steatotic liver disease. It has higher prevalence in males compared with females, and it is associated with increased risk of cardiovascular, kidney, and liver morbidities and mortalities. And it is associated with increased risk of non-liver cancers like colorectal cancer. The association with type 2 diabetes is important and significant. MASLD affects more than 70% of patients with type 2 diabetes in the US. And among those with type 2 diabetes and MASLD, more than half develop steatohepatitis, and 12 to 20% have at-risk MASH with clinically significant steatosis. Patients with type 1 diabetes can also get affected. The overall prevalence is 20% and is primarily driven by obesity. In US, 67% of individuals with overweight or obesity have MASLD. So we can see the close relationship between MASLD and obesity or overweight and type 2 diabetes. The main thing in pathophysiology is increased insulin resistance, which causes lipolysis in adipose and muscle tissues, and then free fatty acids travel to the liver, and they cause fat accumulation and lipogenesis. We're going to have hepatic lipotoxicity, resulting in oxidative stress, inflammation, and fibrosis. Genetic also plays a role. Genetic variants like PNPLA3, IFNL4, TM6SF2 increase the risk for MASLD.